What is the mechanism of manifestation of a Vata Kapha disease? How to understand the pathological events happening in the Vata Kapha disease? This is the topic of discussion in this particular video. Dear ANA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. When you speak about the Dvandvaja Vikara, from the past two videos we are discussing about the Vata Pitta diseases and Pitta Kapha diseases, its pathogenesis. In this particular review, we have started with the mechanism of manifestation of Vata Kapha diseases. When you think about the pathogenesis there, we need to know about the possible Nidana aspect. That is, the तिक्तोषणकषायाल्पवृक्षप्रमिदभोजनैः धारणमुदीर्णैषा जागरात्युच्चभाषणैः क्रियातियोगभीशोकचिन्ताव्यायाममैथुनैः ग्रीष्माहोरात्रिभुक्तान्ते प्रकुप्यन्ति समीरणः. These are the Vata Prakopaka Nidana mentioned in Ashtanga Hridaya, whereas the Kapha Prakopaka Nidana Swadgumla Lavanasnigdha Gurvabhishyanti Sheetalaihi Asya Swapna Sukhajirna Divaswapna Atibrahmanaihi Prachardanaadya Yogena Bhuttamatra Vasantayo Purvani Purvaratrecha Shleshma Prakupyati. So these are the Nidana that is going mentioned for Kapha Dosha vitiation. If the individual is having the exposure to the dual dosha prakopaka nidana, so that means which are responsible for the vitiation of the vata dosha, which are responsible for the vitiation of the kapha dosha at a particular time, then there may be the possibility of the vata kapha diseases. Here we have discussed some of the various mechanisms wherein the possible the pathogenesis of Vata Kapha diseases that may take place that we are going to discuss today. Of course, based on the Panchamahabhuta point of view. Of course, the pathogenesis, the identifying or understanding the pathogenesis of a dual dosha itself is a very laborious process and difficult process. But based on the Panchamahabhuta point of view, the Panchamahabhutas that are responsible for the Kapha dosha vitiation are Prithvi and Ap Mahabhuta. If the person is consuming the substances having the Prithvi and Ap Mahabhuta, there may be Kapha dosha vitiation may take place. If the person is having the exposure to the etiological factors having the Vayu and Akasha Mahabhuta, then there may be the possibility of the Vata dosha vitiation. If you give the equal proportion to all these four substances, Panchamahabhuta, equally 25% will be given to each of these. In that particular situation, there may be the possibility of 2x Kapha dosha vitiation attributable to Prithvi and Ap Mahabhuta, whereas 2x vitiation for Vata dosha vitiation can be given attributable to Vayu and Akasha Mahabhuta. But is it so in the same way that will be the vitiation or exposure to the Nidana related to these Panchamahabhuta? No, it need not be. In some of the occasions, only the Prithvi Mahabhuta is very predominant, up to 50 or 60%. And rest of the occasions, Vayu and Akasha Mahabhuta that may be dominant. In that way, there may be the possibility of the Pitta or Vata or Kapha or Vata vitiation that may be possible. Of course, its impact can be seen in any part of the body. May be seen in the oral cavity, may be seen in the nose, or may be seen in the ears, or may be seen in the tongue, etc., etc. Any part of the body, its impact can be seen. Next, about based on the Shadrasa point of view. It is being mentioned that Katu, Tikta, and Kashaya, they are responsible for the Vata dosha vitiation. Madhura, Amla, and Lavana, they are responsible for the Pitta dosha vitiation. When the person is going to consume these substances in excess, then we are going to expect the Vata Kapha Dosha vitiation. As far as guna point of view, so basically the common guna which is being present for Vata and Kapha Dosha, they are Shita. If the person is going to have the exposure to Shita in a more elaborate way or in an extensive manner, there may be the possibility of the Vata Kapha Dosha vitiation. So, if the person is going to consume the cold drink, the Shita guna, that may be comparatively less. If the person is going to consume the ice cream, then Shita guna, that may be much more in that particular situation. And if the person is having the sugar 10%, the kapha dosha vitiation, that may vary. If the person is having the sugar of more than 30%, kapha dosha vitiation will be much more severe when compared to the 10% sugar in the ice cream. In that way, so contents of each of the ingredients that may have an impact on the Vata Kapha Dosha vitiation. Its impact can be seen in any part of the body. For example, so here Shita exposure, let us say, if the Shita Vata Sevana is there, naturally nose and respiratory tract that may be having the exposure there may be the possibility of Vata Kapha Dosha vitiation in that particular situation. Shita Jala Sevana, Shita Guna increase may be seen in the alimentary canal. Shita Jalaplavana, that is swimming in cold water. This particular increase of Shita Guna may take place in the skin and other appendages as such. Shita Sthana Sevana, so that is residing in the AC room. That is Shita Guna increase is seen in the skin, nose, eyes, ears, etc. etc. Shita Ahara Sevana, that is cold food intake. Shita Guna increase may be seen in the alimentary canal. So like that, the exposure of the Shita in different parts, we are going to expect the initiation of Vata and Kapha Dosha, depending upon the nature of Shita Guna exposure there. As far as Vipaka point of view, Katu Vipaka and Madhura Vipaka substances, they may have the Vata Kapha Dosha initiation. So here, there may be the possibility of Vata and Kapha Dosha initiation in the alimentary canal. So here the impact is seen in the small intestine and large intestine. Virya point of view, Shita Virya will be very highly active. So here there may be the possibility of Vata and Kapha Dosha increase that may be seen in the alimentary canal, that may be seen in the intravascular compartment, that may be seen in the interstitial compartment, or that may be seen in the intracellular compartment. In that way, the impact of the Shita Virya can be seen in any part of the body. Depending upon the Prakopa Karma, it is being mentioned that. So this particular image showing the Kapha Dosha increase somewhere here, whereas the Parushyata increased in the distal part there. In that way, we are going to see the Prakopa of Vata as well as Kapha Dosha in this particular example. So that is Vata Prakopa Karma, that is Parushyata. Sramsavyasa Vedaswapa Sadaruktoda Vedanam Sanganga Bhanga Sankocha Varta Harshana Karshanam Kampa Parushya Saushirya Shosha Spandana Veshtanam Stambah Kashayar Sata Varnashavo Arnopiva. This is Parushya is being mentioned there of Vata Prakopa is seen in this particular example. And Shleshmana Sneha Katinde Kandushi Tattva Gaura Bandhopale Pastaimitya Shofa Apakyati Nidrataha Varnaha Shveto Rasu Swadu Lavanau Chirakarita. These are the Kapha Prakopaka Karma. Based on that, we are going to see the Parushyata and Shofa as such that is going to be observed. So here we are going to say the Dvandva Dosha Prakopa is being taking place in the lower limb, this particular example. Based on the clinical point of view, clinical features point of view. So here, a 25-year-old male presented to you with a history of cough and whitish colored sputum from the past 5 days. The presence of cough is indicative of the prana vata and udana vata dysfunction, and whitish colored sputum is indicative of kapha dosha vitiation. So like that, the person is going to have vata kapha dosha vitiation when the person is presented with cough with whitish colored sputum. Based on the sthana point of view, it is being mentioned that pakvashaya kati sakti shrotrasti sparshanendriyam sthanam vatasya tatra pakvadhanam visheshatah. These are the vata sthana. Urahakanta shirah kloma parvanyama shayorasa medo khanam jayikvacha kapasya sataramurah. So these are the kapha dosha sthana. So we have to inquire regarding these individual sthana, whether any kind of the functions, dysfunctions related to Pakwasha is being noticed, or whether is it any kind of the dysfunctions related to Kati, Sakti, or Shrotra, Asti, or Sparshanendriya, or whether any kind of the dysfunction related to Uraha, Kantha, Shiraha, Kloma, Parvadi, Ama, Shayorasaha. These things has to be inquired. Then only we can able to analyze based on the sthana point of view. Udbhava sthana point of view, Urdhva Amashaya and Pakwashaya affliction may be seen. One ice cream at 9 a.m. may indicate Vata Kapha increase. One ice cream at 3 a.m. in the morning, Vata Kapha increase may be seen. But here the impact of the season also or time also counts here. Two ice creams may indicate further vitiation of Vata Kapha dosha. 4 ice creams at a particular time, Vata Kapha dosha may be increased further. In that way, we are going to analyze based on the Nidana as such. Based on the Samprapti, it is mentioned that Rupa, that is the Vruddhastu Kurte Nila Karsha Karshnoshna Kamitva Kampana Shakrigrahan Balanidrindriya Brahmsha Pralabha Brahmadilata Shleshmadhyasana Sadana Prasekalasya Gaurum Shvaitya Shaitya Shatangatvam Shvasaka Sati Nidrataha. So we have to analyze each of these lakshana whenever we are speaking in terms of the Bala Samprapti. In terms of the Nidana point of view, source of the entry of the pathogens. So here, ice cream consumption, specifically oral cavity, its impact is specifically seen in the alimentary canal. Number of the pathogens, in the sense, the number of ice creams. One ice cream may produce mild vitiation. 3 ice creams may produce a severe vitiation of Vata and Kapha dosha. 5 ice cream, still much more vitiation of Vata and Kapha dosha vitiation is being seen. Virulence of the pathogens. So the ice cream having the, what we say, that the sugar content high, then the virulence is considered to be much more severe. So one ice cream itself may produce very severe Vata and Kapha dosha vitiation. In that way, Nidana point of view may help in predicting the Vata Kapha dosha vitiation. To sum up, Vata Kapha dosha pathogenesis are based on the exposure regarding the Pancha Mahabhuta, Akasha, Vayu, Prithvi and Up Mahabhuta, which the exposure may have Vata Kapha dosha vitiation. Based on the Nidana, as per the Shadrasa, all the 6 rasa intake in excess, there may be Vata Kapha dosha vitiation. Based on the Guna, Shita Guna exposure in excess may show Vata Kapha dosha vitiation. As far as the Virya and Vipaka are concerned, Shita Virya and Madhura and Katu Vipaka may have Vata Kapha dosha vitiation. And observing the Lakshana in terms of the Vata and Kapha, that is the Vruddhastu Kurtenila Karsha Karshnoshna Kamitva Kampana Shakrigrahan Balanidrindriya Pramsha Pralabha Brahmadilata. As far as Kapha dosha is concerned, Shleshmadhisana Prase Kalasya Gauravam Shvaitya Shaitya Shatangatvam Shwasaka Sati Nidrata. These lakshanas can be seen. Regarding the Prakupita Karma, That is Sramsavyasa Vedaswama Sadaruttoda Vedanam Sanganga Bhanga Sankocha Varta Harshana Tarshanam Kampa Parushya Sausharya Shoshaspandana Veshtanam Stambah Kashayasata Varnashavu Arnopiva Karmane Vayoho श्लेष्मणः स्नेहकाठिन्ये कण्डूषितत्वगौरवं बन्धोपलेपस्तैमित्य शोभापत्यदिनिद्रताः वर्णः श्वेतो रसो स्वादु लवणं चिरकारिता. These are the lakshanas that may be observed in a single patient, which may suggest Vata Kapha Dosha vitiation. As far as Udbhavasthana are concerned, Pakvashaya or Amashaya affliction may be seen, or Amashaya and later Pakvashaya affliction may be seen. Depending upon that, we can able to say regarding the Udbhavasthana. Regarding the locations, as such, we have to inquire the dysfunctions of each of these locations. Pakvashaya Kati Sakti Shrotrasti Sparshanendriyam. Sthanam Vatasya Tatra Pakvadharam Visheshatah. Urahakanta Shirahakloma Parvanyamashayurasa Medo Krananja Jikvacha Kapasya Sutaramura. These sthana dysfunction has to be analyzed. As far as the careful analysis of samprapti of Vata Kapha Dosha dysfunction has to be analyzed in terms of the Vikalpa Samprapti, in terms of the Pradhanya Samprapti, in terms of the Bala Samprapti, in terms of the Kala Samprapti. By doing the careful analysis of the Nidana of Vata and Kapha Dosha dysfunction has to be analyzed. व्यायामाद अपतर्पणात् प्रपतनात् भंगात् क्षयात् जागरात् वेगानां च विधारणात् अतिशुचः इत्यादतित्रासतः रूक्षक्षोभकः तिक्तकटुकैरेभिः प्रकोपं रजयित् वायुर्वारिधरागमे परिणते चान्यपरान्यः अपि च. These are indicative of Vata dosha vitiation. Guru Madhura Satisnagda Dukkhekshoksha Dravadadina Nidra Apupa Sarpish Prapure Duhina Patana Kale Shlishmana Samprakopaha Prabhavati Devasado Bhuktamatre Vasante. These are the Nidana that may indicate Kapha dosha vitiation. The person who is suffering from Vata Kapha dominant disease, he may have the mixed Nidana of Vata and Kapha dosha vitiation. These has to be analyzed sequentially, then only we can able to analyze the pathogenesis of Vata Kapha dominant disease. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that to share in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. Something more in the next video. Thank you.